So patellofemoral pain syndrome, or runner's knee, evidence would show this is the most common running injury there is. Typically it presents as pain around the kneecap in some capacity. Sometimes it's on top, sometimes it's underneath, sometimes it's on the inside. So what's happening here, your knee is made up of your femur, your tibia, your fibula, and your patella. So we all know about the femur and the tibia making the 𝘗𝘩𝑚 joint. You also have a joint here where your patella runs into this groove in the distal part of your femur. When your knee is extended, your kneecap is floating and you can kind of move it side to side like this. When you bend your knee to about 30 degrees, this kneecap slides down into this groove in the end of your femur and it doesn't move anymore. It's normal. That is your patellofemoral joint. And so any pain as a result of pressure underneath that joint, abnormal pressure underneath that joint, is known as patellofemoral syndrome or runner's knee. Most common running injury in the world, the research would suggest. We certainly see a fair amount of this at the running PTs. This can present unilaterally on one side or bilaterally. I will say that typically if it's bilateral, there's almost always a form contributor, particularly if you've got bilateral patellofemoral syndrome that comes on later or after the run. That's usually form driven. Some of the types of run form that can contribute to this are sitting back run form, backseat running, or leaning back, overstriding. Anything that increases flexion of the knee in mid-stance increases pressure underneath the kneecap. The unilateral patellofemoral syndrome or runner's knee, typically there is some asymmetry contributing as well. It's important that you find out what that is so that you can address the driver behind the injury and not just treat the symptoms. The evidence for patellofemoral syndrome or runner's knee supports doing hip strengthening and quad strengthening as well as orthotics. I see all three of those things work in most cases. I also would really advocate for you to get a gait analysis because run form is almost always indicated as well. I like to look at this injury as having multiple variables contributing to one symptom, whether it's working on hip strengthening, working on run form, looking into a different shoe or orthotic. All of those variables can be contributing partially to this injury, and that's why it's manifesting itself. So it's important that you address all the things that are contributing to it. You can check out our playlist section for lots of hip and quad strengthening exercises if you're interested. So that's runner's knee or patellofemoral syndrome. Check us out at therunningpts.com to see our gait analysis options.